In terms of fieldwork opportunities, there's a ton out there. There's more than I even knew existed before this summer. And I think that's great because it allows students to really put into practice what they're learning in the classroom. So I'm Kelly Andrejko. I am a neuroscience major and I'm getting a global health certificate and I'm a junior this year. This summer I got the Locomotive research grant to go to Lomé in Togo to do research on the prevalence of traditional medicines. People there have access to both traditional healthcare as well as biomedical hospitals. And my project was to see why they were choosing to use one system versus another. I went in with this perception that modern medicine was going to be better than traditional medicine, and that my project would be to sort of find a way to transition from the traditional system to the modern system. But what I found was that traditional medicine was almost in many ways better than modern medicine in certain situations due to financial concerns or due to the trust people put in the traditional system. Coming back, I felt like the research I did was very important and it was on a very powerful subject. And I felt great knowing that I had given people, I'd started a conversation with tons of people and gotten people thinking about their medical options. This was an incredible experience, one I couldn't even imagine, and I'm incredibly grateful to Duke and the Modi family and DGHI, and it really opened my eyes as to what can be done, and I really hope that what I do in the future, even if it's not in healthcare, I can continue on with global health work.
My name is Jessie Narloch and I'm a senior. I'm in the Trinity School and I'm studying cultural anthropology. I went to Ghana, Africa, and it was actually the second time I've been there. I went there first the summer of 2011 and did Duke in Ghana study abroad program, and then I kind of started a project there on the connections between religious beliefs and the medical decision making of Ghanaians with the intention of hopefully going back to Ghana the next summer. So that's where DGHI comes in, and I was able to get funding to go back this summer and basically partner with a clinic and interview patients about the ways in which being a Christian or a Muslim or a traditional African religion would affect the way they make medical decisions when they're sick. So it's very interesting to even learn about how religion pervades every aspect of life, so they don't even notice it, or they kind of take it for granted when they say, oh no, I don't do spiritual things when I'm sick. But then they'll start talking to me and be like, oh yeah, I go to the prayer camp and have demons cast out of me, but it's not spiritual, it's just normal. Fieldwork is very complex and very exciting, but very hard sometimes. I learned to be very flexible. If I just stayed in the hospital the last 2 weeks, I would have missed out on this whole plethora of knowledge that I got at the prayer camps and at the shrine that I went to. So it was a lesson in how do I, as a researcher, plan but also remain flexible so that I can get the best resources and the best interviews that I can. If the Baines family were here, I would basically want to tell them thank you. This is a huge opportunity for me to grow in not only my love for Ghana and Africa, but also grow in my research skills, in my knowledge of the world, in my perceptions of people. I'm just really grateful. If I can learn one thing that contributes to how we can understand global healthcare, then it was a success, and I believe I did.